Britta S. Approximately 1 in 2,534 people have long QT syndrome. This is according to Thomas H. Marwick, who has worked for over 21 years in general cardiology in the Journal of the American College of Cardiology, published in 2020. Everyone in this room knows someone with long QT syndrome, but you may not be aware because it isn't visible to the naked eye. Long QT syndrome is a genetic disease, a problem with the cardiac conduction system, distinguished by the QT prolongation associated with life-threatening ventricular arrhythmias. First, I will talk about the cardiac conduction system. Second, I will explain what this syndrome is. Third, I will talk about how it is diagnosed. And finally, I will explain what treatments are available. It is helpful to look at the cardiac conduction system. The heart has its own pacemaker. It sends signals to the atria, the upper chambers of the heart, and the ventricles, the lower chambers of the heart. The Purkinje fibers in the ventricles depolarize the cell, causing the muscle to contract, pumping blood to your lungs and body. Now we can understand what this disease is. According to Victor Niera, a professor at the University of Chile, in the Journal of Cardiovascular Electrophysiology, published in 2019, long QT syndrome is an inherited disease distinguished by the QT prolongation on a 12-lead electrocardiogram and an increased risk of abnormal heart rhythms in patients with structurally normal hearts. This is what a normal 12-lead electrocardiogram looks like, and this is what anyone's rhythm with a QT prolongation looks like because of the prolongation between the Q and the T markers. There are 16 genes linked to the syndrome, but only LQT1, 2, and 3 are of significant prevalence. LQT1 is the most common, with a prevalence of 30 to 35%. This genetic defect alters the speed of repolarization of the cell. Repolarization is when the cell becomes negative due to the potassium ions leaving the cell. Long QT syndrome is from the electrical function of the heart, so when the repolarization current decreases, the QT rhythm becomes prolonged. This blue line is the outflow of potassium, and you can see that if the flow were to slow down, the line would elongate, creating the QT prolongation. According to Domenico Corrado, a doctor with a PhD in the journal JACC Case Report, published in 2023, the main trigger of long QT1 is exercise, especially swimming. The second most common type of long QT is LQT2, with a prevalence of 25 to 30%. This type is triggered by emotional stress, excitement, and auditory stimuli. The third most common type is LQT3, with a 5 to 10% prevalence. This type is triggered by rest. Now that we understand what the disease is, we can see how it's diagnosed. If long QT syndrome is suspected, tests are used to diagnose it. The most common way to see a QT prolongation is on a 12-lead electrocardiogram, or ECG for short. This test is used to diagnose all types of long QT syndrome. If the rhythm doesn't show up on the test, provocative tests are used. Low-dose epinephrine infusions are the first type of provocative test. This triggers the heart rate to show on a test. The second common way is a treadmill stress test. This is a test on a treadmill that is increasing in speed and inclines at consistent intervals. During the test, a patient wears a mask, which monitors your oxygen intake, and a blood pressure cuff, which monitors your heart rate throughout the test and during the recovery. Finally, genetic testing is a common way to confirm a diagnosis. Once it's diagnosed, treatment can be prescribed. There are a variety of treatments available, but beta blockers are usually the first form of defense. According to Arthur A.M. Wild, a professor in heart failure and arrhythmias with a PhD in the journal Heart, published in 2021, beta blockers prevent arrhythmias by blocking the adrenaline receptors, which would otherwise boost the heart rate. This form of treatment is recommended in most patients and all with symptoms. For high-risk patients, left cardiac sympathetic denervation surgery is recommended. This removes specific nerve input to the heart. For patients who are survivors of cardiac arrest, implantable cardioverter defibrillators are recommended. All patients with long QT syndrome should make good lifestyle choices. This includes electrolytes being balanced, patients with symptoms cannot participate in most competitive sports, asymptomatic patients can participate in competitive sports, but with proper precautionary measures, such as hydrating, avoiding hypothermia, and having an automatic external defibrillator, or AED. QT prolonging drugs, such as antidepressants, antihistamines, opiates, and most antibiotics should be avoided by all patients with long QT syndrome. In this speech, I first talked about the cardiac conduction system. Second, I explained what this disease is. Third, I talked about how it is diagnosed. And finally, I explained what treatments are available. Long QT syndrome is a genetic disease, a problem with the cardiac conduction system, distinguished by the QT prolongation associated with life-threatening ventricular arrhythmias. It is helpful to know about this disease because odds are, for every 2,534 people you pass, one of them has long QT.